So again, we're talking about beta blockers. Beta blockers, for the most part, end in ulul or lul in some way, shape, or form. Of course, there's a few weird ones that don't follow that, but for the most part, if you see ulul or lul, that means it's a beta blocker. So if we know it's a beta blocker, we are blocking the sympathetic nervous system. They're going to compete with norepinephrine and epinephrine. So make sure that you know what kind of medications and which one are cardioselective, which one are not cardioselective, because that matters if you have a patient that has things like congestive heart failure, or if they have COPD. You don't want to cause lung issues, because these medications, if they're not cardioselective, it's going to go around all the beta receptors in the body. Sometimes in the test, what they'll have is they'll say that a patient has congestive heart failure or that they have COPD, and then they'll list a bunch of beta blockers, and they're trying to see if you know which ones are beta 1, beta 2, or non-selective. Why would you give a person a beta blocker? They have angina, they have dysrhythmias, they have migraines. Propranolol is given for people who have migraines. They're for antihypertensives, for heart failure, and for people who have glaucoma. And I probably pronounced that wrong, but it's okay. The medication for that one is timolol. What would be some of the contraindications for your beta blockers? Again, really important to know. You don't want to give people medication without knowing what the contraindications are. Again, always, are they allergic to it? Do they have a hypersensitivity to it? Do they have uncompensated heart failure? Are they in cardiogenic shock? Do they have a heart block, bradycardia? Pregnancy. Do not give beta blockers to pregnant women. If they have severe pulmonary diseases, again, beta blockers and lung issues is a no-go. Don't do it. What you're going to do for your patient, you're going to monitor their vitals, and you want to know what normal values are. So if their pulse rate is less than 60, don't give them a beta blocker, because it's going to dilate those blood vessels and drop their heart rate. And also look at their blood pressure. If their systolic is less than 90, don't give them this medication. Another crazy thing about beta blockers is that they can mask hypoglycemia, with the exception of sweating. So if you have a patient that is diabetic, this is really important for you as a nurse to watch out for, because you're supposed to look if your patient that's diabetic is getting hypoglycemic, but if they're on a beta blocker, you might not see the classic symptoms. What if you over-medicated your patient and their blood pressure dropped significantly? What would you do? And what is going to be the antidote, or how you're going to treat it? If somebody's bradycardia, you're going to give them atropine. And then here, I'm going to stop the non-selective beta blockers and what are the cardioselective beta blockers. And a little tip and trick that kind of helped me for the cardioselectives, they have a way of saying one, or I made it say one in a way. ACE is one. So atenolol, if you're a 10, you're number 1. B, there's only one of me, so 1. Tropolol, again, me, there's only one of me. One that's really weird that didn't really fit in there, but I made it fit because of Spanish, is esmolol. So I was like, oh, it's small. So 1 is small. It might be a reach, but if it helps you, it helps. When it comes to providing teaching to your patients, you want to make sure that they don't just abruptly stop these medications, because beta blockers, if they're stopped abruptly, they can cause a lot of issues, especially with your adrenal glands. And you want the patient to take the medication as prescribed, always. You also want to teach the patients what to inform you of. And with beta blockers, you want them to report if they're constipated, or they start developing urinary hesitancy, or they have bladder distension. And always tell that patient, don't mix alcohol. Honestly, at this point, with any medication, don't mix alcohol.